Welcome to Perimenopausal Athletes and Beyond, a masterclass series where we bring together experts in physiotherapy, pelvic floor health, particularly coaches, nutritionists, functional medicine, reproductive endocrinologists. It's the full, amazing, right?
So cool.
Amazing. And today I have the incredible Julia DiPaolo. DiPaolo. And I'm just so thrilled that you said yes again. We had a conversation in the masterclass series in the spring, and at the end of that I said, you know that I'm asking you again, and you said yes. And then here we are sharing a conversation and something that we both feel that is just so absolutely important to get out to all the females in our lives, really.
Yeah,
so welcome.
Everyone with a pelvic floor. Thank you, Tanya. Thank you for asking me again. And oh my God, thank you for getting this message out. I got so much good feedback, even just from my patients who already know this stuff. And then we're like, oh my God, this person and that person, you brought such amazing people together the last time. I am so honored to be brought back again. Like, seriously, I'm so thrilled.
Well, so I'll just tell you a little bit more about Julia, because not everybody has had the privilege of meeting you yet. But essentially, Julia has been an expert for over 20 years in looking at, female health generally, orthopedics, sport and spine injuries, then kind of navigating her way into women's health, looking really at diastasis recti abdominis, and has written books. You have a new book that you just did?
We have pregnancy fitness, and we have the labor and birth, which will be less relevant for this group. But yeah, those are the two books.
Two books, right? Yeah. And then you're working with the University of Toronto in the physiotherapy department. So essentially we have the most perfect expert to talk to us about the pelvic floor.
Yes. So much fun.
So much passion. Okay. So where we're going to go today is we're going to go through the 3 myths that you had brought forward, because I think they're really, really valuable to hear again. And one thing I'm going to put this out there, and I do this only in our interview. I'm like, we're going to challenge you to get the word out and tell 5 girlfriends, your mom, your sister, your cousin, your neighbor. It's right on Julia's, email. This is our mission to get the word out about the importance of understanding the center of your universe, which is the pelvic floor. Yeah. So with that being said, let's get going. Hey?
All right. Yeah.
Myth number 1 that you brought forward was urinary incontinence is normal as you age.
Wrong. Absolutely, completely false. I don't care how old you are. I don't care how many kids you've had. It is never, ever normal to leak urine out of your bladder when you are not sitting on the toilet wanting to pee. It is the very definition of incontinence. And I get really irate with this light urinary bladder leakage. That term drives me insane. It's incontinence, whether it's a drop, whether it's a full bladder. Mm-hmm. If urine leaks out of your body when you're not trying to pee, it's incontinence. And so it's not normal. It means that there is a problem. And so for most of these women are going to be athletes, right? That are listening in.
Absolutely.
So if you're out there and you're watching someone do a really nice bicep curl and they start doing this, right? You're going to cringe. You're going to go, no, and you're going to fix their form. It's the same with bladder leakage. So if you leak urine, it is a failed load transfer. It is poor form. It means the pelvic floor is not in synergy with the rest of the body, and therefore the bladder is not being supported. The pressure is too much and the urine comes out. So it's really about form and fitness and the functionality and the synergy in the system. So if you have leakage, the good news is it's actually pretty easy to fix. We are about 80%, we have about an 80% cure rate, particularly with stress urinary incontinence, particularly with female athletes, because you guys have motor patterning. It's so easy to train you and to retrain the bladder and the pelvic floor. So you the most important message on this one is you do not need to live with urinary leakage. Incontinence is not normal at any age, no matter how many kids.
No matter how many kids. And just to really stress this, I know like we're going to get into myth 3, but you stress the as you age part. As athletes in perimenopause and beyond, our estrogen is reduced, but even then it's not normal. You can still do something about it.
Right. And if the exercises aren't enough, look at your hormones, look at your diet.
Mhm.
And we did this last time. I love estrogen. Do you have someone talking about estrogen this time?
No. So
No.
if
Okay.
you want to
So,
just talk a
okay.
little bit about Jen,
Yeah.
it would be
So,
great.
yes.
Mhm.
So, yes, my best friend, Jen. I adore estrogen,
Mhm.
and I'm partial. So I'm partial to either a gel that goes on your arm if we're going to get into the more systemic hormone stuff. But if we're just talking about the vagina, estrogen is the vagina loves estrogen so much that she does not share with the rest of the body. If you put an estrogen cream in your vagina, it's going nowhere else. It's not going anywhere systemically. That's how much the vagina loves estrogen. I'm a huge fan. Now, you don't have to use estrogen if you don't want to or have a real medical reason. And that's a whole other
Yeah.
tangent to go on. But there are great books, Estrogen Fix, Estrogen Matters, that you can look up to see if the real science and the more modern science compared to the 2002 horrendous study that was just a complete debacle for women.
Mhm.
So the point, staying in my 2 minutes on estrogen.
Yeah.
So the vagina loves estrogen. If you happen to be one of the women that really, truly can't use estrogen, then you can use a moisturizer to help with the tissues. But yes, no, estrogen is important. So if you're leaking, it could be that the estrogen has decreased enough that you don't have that elasticity in the tissues anymore. And it's very hard for the floor to kind of have that reflex,
Right.
particularly if you're lifting heavy, moving quickly, jumping, any kind of sports that you're doing. If you have that quick turn, quick change of direction, all these sports require the floor to have a quick reflex and a locking. And then if you cough or sneeze or laugh, you also need that quick reflex.
Right.
So if you've done all the exercises and you're still having issues, then we move away, we continue with the muscular stuff and the physiological stuff in terms of musculoskeletal, but then we always want to look at diet, hormones, and what we need to do to support the rest of the system, because it can be a problem that's coming from somewhere else, not just the pelvic floor itself.
Yeah, and so one thing, okay, slight tangent, and I don't know how much we will get to myth number 2 and 3,
All
but
day, all
there
day.
was
We'll just keep
one
going on
thing
tangents.
that I'm curious, and I don't know if that you have a comfort in talking about this as an expertise, but you mentioned something about the microbiome of the vagina and how important that was. And like I just know of the microbiome in the gut and how critical that is for your whole hormones. Like if your gut health isn't like on it, then your hormones can't function in the
No.
optimal way at all.
Yes.
So I'm curious if you have any thing to say on that you feel comfortable with or that
Oh yeah.
aligned with your practice.
Yes.
I don't know.
Oh, totally,
Yeah.
totally. So pelvic physios are a little bit different. We get obsessed with nutrition and the microbiome much more than a regular sports physio would.
Okay.
They might go into more hydrating and protein and macros and micros. We're going to get into the microbiome. Because the gut has such an influence on the pressurization in the system. So if you're distended, if you're bloated, if you have IBS, it's going to change that synergy between the abdominal wall and the pelvic floor. Now, one thing to really, I freaked out my teenage boys just the other day with this. So the mouth and the anus started as the same cells and then evolved into this one long tube. So your entire digestive system is not actually part of your body. It's actually its own system. And so your microbiome is full of all these bacteria, viruses, even parasites, and they all live in perfect harmony, just like the world should live in perfect harmony, all different kinds of people, all different kind of bugs and animals.
Yeah.
What happens if you eat certain foods or get stressed or your hormones go off balance, that can disrupt that microbiome. Now, when you look at the chain from the mouth to the anus, you've got your throat, you've got into your stomach, into your intestines, down into your rectum, into your anus. Your vagina is not patent, it's not open to this system, but it is directly related. And Mother Nature is brilliant because when babies come out, they need that microbiome to start their microbiome. So we have vaginal microbiome and we have the rectal microbiome, and they're right next to each other on purpose so babies can get that little bit from both.
Mhm.
In the vaginal microbiome, it is more acidic. I get
Mhm.
these words wrong. Alkaline and acidic. So I could be backwards on this and I do apologize.
Yeah.
It's one way, it's not a neutral pH like the rest of the body.
Right.
So then I'm pretty sure it's acidic. Menstrual flow and semen are alkaline. And again, I apologize if I've got these
It
backwards.
is. Yeah,
It's
it
correct?
is. You're right.
Okay, perfect. Thank
Yeah.
you. So when you have that, if that acidity changes at all, you're going to be more likely to have something like BV or STIs or any kind of yeast infection or UTI. And so we want to keep that microbiome in the vagina at its acidic level. Now, the microbiomes are brilliant. The vagina is brilliant. Mother Nature is brilliant. So, you know, you don't have to do anything differently as long as you're eating healthfully, resting, sleeping, doing all the good stuff. You already know how to do all that stuff. There is absolutely no need to douche or shower or clean a vagina. It's a self-cleaning oven, particularly because it's on that acidic level. So it gets rid of stuff. When that microbiome gets out of balance, we have problems. And when the estrogen and progesterone and testosterone in a female body are off kilter, that microbiome will go off kilter. So
Mhm.
it's deeply connected to your microbiome in your gut. And some women do just as fine taking probiotics for their gut, and that's enough to clear the whole system.
Okay.
Other women, and particularly my patients who do get BV, so bacterial vaginosis, yeah, they'll do a vaginal probiotic. And as a physio, I can't prescribe that. I can't prescribe really
Mhm.
very much at all. So I'll send them to a naturopath to do that. Some doctors will do it. Some advanced or really kind of more fringe doctors will prescribe the vaginal probiotic, and that will help settle up. And I believe it's a lot of lactobacilli versions of
Mhm.
the microbiome. And there's too many. I don't
Right.
memorize them because I can't prescribe them anyway. So I
Yeah.
trust the naturopaths to just give them the right ones. But
Right.
eating fermented foods and healthy foods will help maintain that. But yes, so if your estrogen levels and all your hormone levels go off, it could affect your microbiome in the vagina, which would then make you potentially more sensitive to the semen if you're having a sex without condoms with your partner, or it could make you more potentially getting bacterial vaginosis if you're having sex with different partners. So there's a big thing. The vagina is so fascinating and so brilliantly designed, but we need to take care of her. We need to do the right things.
Yeah, and I just love it how you're and this is what one we're going to get there is is that you have such a whole body approach, like how we, I mean, you do call it the center of the universe for a reason, because you've mentioned a couple things already, and this is where we're going to go, is like how does child, like when you're having problems with your pelvic floor, how does it show up? And you've already mentioned a number of things, so we're going to come back and we're going to reiterate those, but let's get into myth number 2. So myth 2 was you cannot exercise, run, or lift if you have a prolapse.
False. So absolutely, you need to be careful, right? So prolapse, and most doctors won't diagnose that grade 1, grade 2. Oh, we get to bring out the props. my
Of course,
selection of props.
we love
So,
her. There she is.
oh, the wondrous velvet vulva puppet. So clitoris under the hood. This is everyone has the video access, right?
Yeah.
Okay. So clitoris under the hood.
Yeah.
The little rosebud is the urethra, right? And that's the urethra, so that's deep inside. This where my hand is the vagina.
Mhm.
So this on the outside is vulva. So vulva, inside is vagina. I'm not overly let's say anal because it's just a fun word to pun with. I'm not overly anal about the terminology, but it is nice to know the difference. So vagina is the inside, the tunnel that goes up to the uterus. Vulva is on the outside. The purple is the labia with hair. The pink satin is the labia with no hair, so labia minora. So if we go inside, I almost forgot the question. So prolapse.
Yeah.
So most doctors will not recognize a grade 1 or grade 2 prolapse. And what they are, a prolapse in general is the organs pushing down into the vagina
Mhm.
and coming out of the body eventually. So we have 4 stages of prolapse. A grade 1 or a grade 2, really doctors don't pay attention. You may not even notice, you may not have symptoms. A grade 3, you might notice because it'll be right at the opening. So you can
Yeah.
just kind of see it there. And then a grade 4 would be out the door and and on the floor, which is very politically incorrect to say. So basically, once you get to a grade 4 prolapse, it's much more difficult to do these heavy lifting, these high intensity activities. So what we want to do is we want to get you preventatively protecting the prolapse at the stage 1 or 2. If you're at a stage 3, then a pessary might work. So it's like a sports bra for the pelvic floor. So get a little bit of support in through there. It looks like a diaphragm or a diva cup, but it's specially designed to give support. And then a grade 4 is much more difficult. And I think I have it in the previous one, the story about my 60-year-old patient with the grade 4 prolapse.
No.
Did I tell you her story? Do you remember? So I got a patient, she was in her 60s and she had a grade 4 prolapse. So her bladder was literally sitting outside. And when she'd get up to walk, it would bleed because she would rub against between, like, think of your thigh chafing, but the bladder's in the way. So it was horrendous for her. So with a little pessary, so we got a pessary to get it inside. She worked with my kinesiologist. I cannot take the credit. She did the cute little 13 Kegel exercises,
Right.
But she did the
Everybody will
real
receive.
exercises.
Yeah.
Perfect. She did the real training with the kinesiologist. And so within, I think, 3 or 4 months, we had her deadlifting 40 pounds. Now we're talking about a 60, 65-year-old, teeny tiny little Asian woman who has a grade 4 prolapse. So 40 pounds was huge for her. I know it's not a lot for most of your viewers, but it was huge for her. And it's all to say, all we did was correct the prolapse, give it some support, train the muscles to work, and then train her how to manage her pressures. So the problem with prolapse is if you bear down, this is what happens.
Right.
So if you're uncontrolled, if your pelvic floor, which sits inside here, is supportive, then it doesn't come down because you have that support through there. So the goal is to teach you, if you have a prolapse, how to connect with your pelvic floor, synergize them with your abdominal muscles, because that's where you're going to get a lot of that pressurizing, particularly external oblique. So anyone who's oblique dominant and has a prolapse really wants to work on that synergy. And then so we synergize, and then we start loading. We look for that failed load transfer. Are you doing something crazy?
Yeah.
And then we build, we pull you back, we scale you, and we bring you back. Are some women never going to be able to lift heavy? Yeah, maybe there's just enough damage to the tissue that they can't. Just like after a crazy ACL repair, you may not be able to downhill ski as a racer anymore. And so then we just change your focus and we give you something else that you can really love and do and still be fit and healthy and do whatever as close to what you want to do as possible.
Yeah.
But a grade 1, grade 2 prolapse, the danger in ignoring them, which is what drives me crazy with the allopathic Western medicine, is if we ignore a grade 1, grade 2 prolapse and we go off and we lift heavy and we're powerful and we're going to do it no matter what because we're strong and we're female, and you don't correct those synergies, you actually will end up with a grade 3, grade 4. So initially 10, 12 years ago, it was this big panic online giving exercises because we couldn't tell how they were managing their pressure. So it was stressed me out to no end. So there's a message initially that was, you can't do this if you have a prolapse. And now we know that A, women are way more intelligent than that. And B, we can do stuff through video quite easily. Yeah. And so we can train, we can teach these women to use their bodies appropriately, prevent prolapse, protect prolapse, and go and live and be happy again.
Can you just share, because we are on such a mission to support the conversation getting out, what did that tell me? Just give me a glimpse into what it was like for that woman that was 60 years old and when she first did that 40-pound squat, or, you know, like what was that to witness that?
So prior to getting into pelvic health, I was in a spine sports clinic and I was working with desiccated, herniated discs, like these really traumatic, huge injuries. Nothing is more devastating than a prolapse to a woman. Mm-hmm. And I really, really wish I had taken a picture of her on her first day, which was defeated, hopeless. I'm never going to walk again. I can't go back to the gym. She was given, the prolapse was obviously on its way. She was in her 60s. She had 30-year-old children, 2 of them. But she was working with a trainer who gave her, I think, a 40-pound plate to do crunches with, right? Because her doctor wanted her to build her bone strength, and rightly and intelligently said, go do weight training, and then gave it to the trainer who wrongly gave her an exercise she was not ready to take on. No. And so when she came in, and the kinesiologist actually videoed it, to show me how perfect her form was. And when she came in after doing that, she was lit up. She was happy. She was, oh my God, like I met her in this hopeless state. So I have nothing to compare. But man, oh man, like to have that life again, just like we breathed life back into her. She walks 40 minutes to work. She goes to the gym after work. She stands, she works in a hospital. So she's on her feet all day. I can't remember what she does for a living. But I remember she's in the hospital standing, and it was just, she couldn't do anything. And then she was getting grandchildren. Her daughter was pregnant. So there was this big fear she would never be able to lift up her grandchildren. She wouldn't be able to play with them. And we just gave her life back. Like it
This
was
is
just, this is why I
it.
love what I do.
This is it. This is why, it's why I do what I do, is as to really, what we do in sport reverberates throughout our entire life.
Oh
This
my God,
woman,
right.
you know, that you speak to, she works in a hospital. She could be working for you, and now she doesn't have to suffer in silence. And
No.
I just, this is why the message is important to get out. This is why we want these interviews to get out into the world. It's just,
And
okay.
tell
So
5 women,
anyway, just
tell 5
thank you.
friends, tell 5, tell your doctors,
Yeah,
tell your
like
midwives.
we've
They
got
don't
to
all know about this.
keep
They
talking
really
about
don't.
this and
Yeah.
keep sharing. So myth number 3, pain
Yeah.
during sex is totally normal, part of menopause.
No, 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 no.
Right.
Oh my God. I am so obsessed with this. So, no, sex, pain. So, let's start with the clitoris. More toys. This is my favorite. So, the clitoris. So, everyone recognizes the clitoris as the little bump, right? This
Mm,
teeny tiny little yellow piece. That's
yeah,
how it's represented,
there she
right, in
is.
anatomy. But many of you will know the clitoris is actually, there's quite this big thing. And somewhere between 12 and 15 weeks, both male and female babies are like this. And then by 20 weeks, this has turned into a penis and the testicles. In the women, it stays like this. So we know that for men to get erect, this is the, this is, sorry, the testicles, this is the spongiosum on the side. So these are erect tissue, so they get thick and full. And when you look at where this actually sits on the pelvis, so these are almost to scale. Look how big that is.
That's so good.
So this blue would
Yeah.
be representative of this spongy tissue that fills up and gets hard and erect. This is what holds the penis hard and erect. So we have that tissue on either side of the labia with no hair, right? In between, and then on the outside would be the labia with hair here. So this whole thing is the clitoris. Now, the most important thing to remember about the clitoris is it only has one job. It is the only organ in the entire body, male and female, only organ that has one job, and it is pleasure.
I love
It
that.
does nothing else. This turns into the penis in the men and has to urinate. We urinate out of our urethras, which are sitting somewhere else, right down here. So the urethra would be sitting right here. So if Mother Nature, who doesn't waste anything, right? Everything in your body has 2, 3 jobs because it has to take over for something else. So she, in all her wisdom, created an organ for the female body only that is only designed for pleasure. So someone explained to me why pain during sex should be considered normal when this is for pleasure. So if you're experiencing pain during sex, there are many reasons why this is happening. And we need to dive to the root cause of this, because sex should be absolutely pleasurable for women. And because, like, when you look and you think, well, I can only get orgasm through clitoral stimulation. Yes, because the clitoris, this is very, very highly sensitized, same as the head of the penis, lots and lots of nerves there. But the whole thing, so because this is erectile tissue, this will fill the vagina. So as the penis comes in and using different positions, you should be able to get the whole clitoris between you and your partner, right? So between his penis and then his pelvis. And if you have a female partner, between the strap on and then her pelvis. And so there is so much to talk about with this. But the moral of the story is, if you have pain, if it's from dryness, a glass of wine will do nothing. Tell your doctor to F off. You need either some kind of lubrication, or again, back to my best friend, Jen, which is one of the reasons she's my best friend, because she helps with the lubrication and making sex more pleasurable. So looking at the root cause, again, if we're going to look at this dryness, why are you dry? Are you having trouble with your diet? Are you having trouble with your general systemic hormones? Or is it just a really local thing? right? Do you have scars from when you had your baby? So episiotomies and tears that didn't get fully resolved. And now that the tissue doesn't have its elasticity like it did before, now those adhesions and that old scar is now being pulled during intercourse.
Yeah.
So one thing to keep in mind that we can't do a lot of change to is when we think of the vagina in a young woman, we think of it as a pleated skirt.
Right.
And in an older menopausal woman, we think of it more as a pencil skirt. So we need to give more to that pencil skirt. So it needs to have material that is more stretchy than something that would be pleated, which with stricter material would have more give regardless. So looking at diet, looking at estrogen, progesterone and testosterone can also be useful. And some women need testosterone, not everyone needs estrogen. So you need to have this plan done specifically personally for you and your hormones tested. And I think one of your speakers last time said around day 21 is the ideal time to do some testing. So find that video and get back into that. The moral of the story is pain during sex is never normal.
Yeah.
The only two times I will really accept it is your very first time, particularly if you still have some hymen. It's not going to be great. It's not going to be comfortable. But after the second or third time, it should be fantastic or get a new partner. And same with postpartum. The first and second time might not be so great. Especially if you're breastfeeding, again, you're going to be dry. Again, there's going to be some tightness. And if you've just had a baby, it might be some stretching or some tearing. But again, after the second, third, or fourth time, it should be fabulous again, or at least feel good. It may not be fabulous because you haven't had any sleep. But menopause, no, baby, that should be the best sex of our lives.
I love it. Okay. So that I'm glad we went through it because you gave a lot more, and you touched on different other things as well. So there's just so much that you can take in with this information. Okay. So what I want to kind of end with is, and of course we don't have much time because we always run out of time, you and I, is just all day. I know we totally would. So there's so many ways that when we have pelvic floor dysfunction, it shows up. And so you've done, you've written a list for me. So I'm just going to go through and cue you to what you provided me. And then if you want to add on. So 1, back pain.
Yes. So this is the easiest one. So we have studies that go from about 80% to 92% of women who have low back pain have a corresponding pelvic floor dysfunction. 92%. So you might as well just say everyone with back pain has a pelvic floor problem. It's just 92%.
It's so likely.
So what we tell physios, particularly orthophysios, is if you're seeing back pain patients, and this is kind of how I ended up in pelvic health from the spine clinic, the likelihood of them having a pelvic floor dysfunction is very, very high. So if you're a trainer watching this and you have pain patients or clients who have back pain, if you're an athlete and you're suffering from some back pain, this is a real issue. And if no one's addressing your pelvic floor, get your pelvic floor assessed. Or like we said last time, you can assess your own pelvic floor by sticking your fingers in your vagina anytime you want. So if you're to check it, and we didn't go over this in this one, you can check the video. You'll have the other video posted. So they can go in and talk about the tight, like the floor that's too tight and the floor that's too lax.
Absolutely.
So we won't go there today. But if the back pain, you can have either. You can have that tight pelvic floor or a lax pelvic floor. So it's not about going off and doing 100 Kegels. It's about figuring out what your floor needs and what your pelvis needs and what your back needs. And then again, that synergy. The other really cool thing about back pain and pelvic floor for the really, really geeky anatomy enthusiasts is the multifidus. And I don't talk about it a lot in these sessions when we're dealing with public, but if you're really geeking out on the anatomy, the multifidus is the fourth muscle in what we call the core 4. Diaphragm, pelvic floor, transversus abdominis. And multifidus looks like a little Christmas tree going up and down the spine, 2 to 3 levels, all the way from the cranium right down into the SI. It is super important for stabilization. Shuts down with back pain, particularly a disc injury on the same side, but also because it's synergistic with the pelvic floor and transversus. If that's shut down, you've lost that synergy of the core 4. You're going to struggle transferring load from top to bottom or bottom to top. So you're not going to lift as heavy. You're not going to run as fast. You're not going to turn. You're not going to hit the ball as hard. There's going to be more difficulty from that back injury, which could have led into some pelvic floor dysfunction. So that one's really common.
Yeah. So do you recommend, is there a sequence so somebody has troubles with their lower back, particularly on their lower back. Do you see the pelvic floor specialist first? Where do you go? Like,
Depends on the story.
okay.
So, having spent my career in both fields of spine therapy and pelvic health, and really it's all one field. But the first part of my journey as a physio was really in a spine clinic, and there were just those people that didn't get better at the end of the day. And
Okay.
what really turned me was I would have two lawyers, both in the same office, both with the same job, sitting all day. He would get better, she would not. And so that really kind of, and it's not a socioeconomic thing, it's really a change in the anatomy. And so men tend to get better, although I do have a story about one of my back guys who did need pelvic floor work
Mhm.
to get lifting, and he's got a great story. So to answer your question, it depends.
Okay.
Um, One of the things, if someone comes in with leaking, prolapse, and back pain, I usually clear the spine first. It's easier, it's faster. We can do a quick, I like the McKenzie mechanical diagnosis and therapy approach. It's a simple bend forward, bend backwards,
Yeah.
side bend, or um, side glide, see where the restrictions are, give them exercises, clear the spine, and then we can delve into the pelvic floor, which is unusual for me because normally I go straight to the floor, clear the floor, and then go around. But
Mhm.
the floor will not work well if the back is out, right? And out, we're not supposed to say that, but if the back is irritated
Right.
and we're having issues with the back. So my tendency is to clear the spine first. So for those of you listening, and especially if you're far away from a pelvic physio or you have a sports physio
Mhm.
already, get them to clear your back. And if you're not getting better with your back treatments, you're likely having a problem connecting with the pelvic floor or those core four muscles in the system.
Mhm.
And my guy story, which is fun, he he was sent to me, and so he had a herniated disc or a bulging disc, and he was 6'3" or 4", 300 pounds, didn't even fit on my bed, and he was a rock climber,
Yeah.
and so very, very strong guy, and would lift crazy amounts of weights. And he came in one day and his back was doing better, but we really needed to work on his pelvic floor and his stability through the system. So we did all that. And he came in one day and he said, Julia, I need to stop your dinky little pelvic floor exercises. And I'm like, why, are you re-injured? He said, no, but ever since you gave these exercises to me, I'm now lifting twice my body weight over my head. And that's just a stupid amount of weight to put over your head. And it's too easy. He's like, 100 pounds ago used to be hard, but his system was in such beautiful synergy. And this is a huge man. His system was now controlling his pelvis and his trunk, and his arms and shoulders could just lift power over his head. It was so like, and I'm jumping up and down, right? I'm like, yay, this is
My
exactly what's
dinky
supposed to
little,
happen.
your dinky little exercises that you provide
Oh,
us that everybody has access to, like the
yes.
13.
Oh, yeah. And you don't have to do them all. Just pick the ones you like.
Well, yeah. So okay, so that goes into
That's
your
back.
third point of it, you just have massive access to, if your pelvic floor is working, it's amazing. You become more powerful.
Oh,
And talk about it. I mean, I know there's a process. I know that it's work. I know that there's time involved in getting your pelvic floor to work optimally. But at the end of the day, we want to be strong. At the end of the day, we want to be lifting, things over our
what,
heads because that's what we
whatever
need to
you
do in our
want.
life.
Yeah, as much weight. I you can tell by my arms, I don't lift super heavy. I do like, although after our last one, I started lifting 10 pounds.
It's
I
awesome.
started doing,
See?
I started, because I forget who it was, but the heavy lifting for the perimenopausal woman is a good idea, right? And I love my Peloton, I love my cardio, I love my little 5 minute,
Yeah.
3 pound weights and sculpting. And so I'm not very good at it because I don't enjoy it as much, but
Yeah.
I have been doing 10 pounds, not that you can tell. But anyhow, but when your floor works, and the one point I do want to get across is you don't need a massive pelvic floor contraction.
No.
It's actually a small, the pelvic floor picks up blueberries, not pianos. If you're picking up pianos with your pelvic floor, you're wasting all your energy and directing energy in the wrong place. Pick up a little blueberry, exhale, and power up through the big muscles.
Yeah.
You don't have to have a super strong, powerful pelvic floor lift
Yeah.
to lift heavier. And in fact, the inverse is true. The gentler you use your pelvic floor to stabilize, the more power you have to do other things. And that's why the synergy and the automation is so important. You really shouldn't have to think about picking up your blueberries every time you want to lift something over your
No,
head. You shouldn't. You
right.
do at the beginning, but then you should be able to motor pattern that, just like you motor pattern any shot or any serve or any new technique or any new movement or dance routine or anything.
Interesting. Okay,
Mhm.
so next, because we're gonna have to get through these next ones pretty quick here. One
Okay.
that I'm really fascinated by is hip pain, and
Mm,
what yeah is showing up there.
yes. So interestingly, oh, and I'll double up the story with the singing for you.
Yeah,
So with the hip pain, so hips sit right here. So this is the pelvis,
yeah,
and the organs are all kind of messed up. So I'll just dump them out. Okay. So all the red inside is, there you go, is the pelvic floor muscles.
yeah,
All the white is the bone. Other than this blue for the clitoris,
yeah,
we've got this gray is ligaments, and there should be one on the side, but I took it off for demo. So one of these muscles in the pelvic floor, the obturator, actually goes into the hip.
right.
And so when you've got the pelvic floor, particularly pelvic floor that's too tight, is going to pull that hip and jam it into the acetabulum and jam the joint. So if you take your hands, and everybody do this, take two hands and make really tight fists like you're holding on for dear life. And now roll your wrists around, holding tight, holding tight. Doesn't feel good. Now
Oh,
relax your hands and let them just flow. Doesn't
oh
feel
my
nice?
goodness, look at that, hey.
So if your pelvic floor is super tight and holding on for dear life, it's going to jam that hip up. And then when you go to move, it's not going to feel good. So the other thing is it won't feel good. Oh, my little one. Okay, more props. This is the new prop. I'm so excited. My girlfriend gave me this. She's so lovely. Lori O'Neill. Okay, so the pelvis moves. Can you see that? Okay, maybe if I put it in front of me. Can you see that it moves? There
I
we
can
go.
see it. Yeah.
Okay, perfect. So that moves. So if you've got pelvic floor muscles attaching to all the points in here and they're super tight, it's not gonna move, right? It's gonna be this awfulness. So you're gonna get irritation through here. And then of course, we'll use the big model, but through here, all
Yeah.
these nerves come out and down into the hip and down into these muscles. So anytime there's too much compression, too much load, something's irritating, you're gonna get a chemical irritant. It's gonna irritate the nerves and you're gonna get a pain message to the brain. So one of the reasons the hip goes into pain from the pelvic floor is from that one muscle, a direct physical link. And then the other reasons is the pelvis may be too tight and not moving well. And so then the hip can't transfer load nicely, or because you've got the nerves irritated because something's going on in there. The last one would be the back pain. So backs can send pain down to the hip. And of course, that's going to go through all here as well. So clearing the pelvic floor when there's hip pain is I do every time. Absolutely. I usually get hips that didn't get better in regular physio, so I go straight to the floor on those.
Mhm.
And usually it's releasing, connecting, and then moving correctly, and the pain goes away.
Yeah.
And I'll tell you about my singer.
Yeah.
So one of my patients, no kids, in her 30s, referred to me because she had hip pain, and so got her in. Her pelvic floor was super tight. We released her floor. We got everything settled nicely. We got her connecting to her floor in on off, beautiful, beautiful release. And I realized she's a singer. And so I haven't done a lot of work with this. When a couple colleagues in the United States, I think it's Ginger Garner and my friend Susan Clinton have done tons of work on this. And when the floor is part of your vocals,
Yeah.
and so she's a professional singer. So I've got her floor nice, she can move, she can dance. And I said, sing me a few bars. And her voice was off. I'm like, okay,
Oh
so
dear.
now you have to go and practice keeping your floor at this nice tone and learning to use that reverberation off the tone. And we do this in birth as well, where low growling sounds reverberate down. You never, ever, ever hear a guy going, they
Yeah.
all go, ugh. So
Right.
we know that that reverberation in the pelvic floor affects breathing, affects vocalization. So for anyone who has to, talk while they're while they're athleting,
Yeah.
let's make up new words now, Tennille.
Yeah.
If they have to talk or like sing while they're dancing, kind of thing. So, or if they're, a performer and they're performing with words or music or sound, their pelvic floors will have an influence on their ability to project their voice and what notes and sounds they can make. So it's really, really fascinating. So she did it. She had 2 days, thank God. So she practiced her voice, called her voice coach, went over to her voice coach, practiced her floor. We lost a little bit so she could produce on stage. And then it took us a few weeks to really get her in sync with her voice and her pelvic floor staying, but her head pain went away and her voice came back. So it's really cool.
So these are just a couple of them. I'm just going to read the rest off for people because I think it's important for us to understand when you're having pain, A, pain is not normal, and B, there are so many different ways that we can go about addressing pain, and the pelvic floor needs to be considered in that. So the other ones that you mentioned are loss of rotation in the thorax, irritable bowel syndrome and bowel issues. We talked a little bit about that already. Headaches is a big one. Fascinating. Balance. And I just, there's something we can do about it.
Yeah. And for the, because I'm sure you have a ton of runners and triathletes. And so if your pelvic floor is tight, your pelvis has to rotate and your thorax has to counter rotate when you run, especially if you're a throwing athlete and if you're a running athlete and even the swimming athletes, although it's not as evident. So if you're having issues in the pelvic floor, it's going to affect your ability to run, your performance level on running. Mm-hmm. And what was the last one? I wanted to make a point on that one just
headaches
really quickly.
Or balance?
Oh, headaches. So very, very interesting. Your head and your pelvis are in synergy, craniosacral. Everyone's heard of craniosacral therapy.
Yeah.
So your dura attaches into your coccyx. Your pelvic floor muscles attach on the other side of the coccyx. So any pull on that coccyx, which look, it moves. I love this little thing. Oh, so when your pelvic floor attaches on this side and your dura attaches on this side, if the pelvic floor is pulling it, it's going to pull down and can give you those tension headaches. And prolapses can give you headaches too, because they'll pull on the fascia and give you all kinds of stuff. I know.
So, there are so many of these are, we call them symptoms of perimenopause, and it's like, okay, well, blah, blah, blah. But there's so much we can do. All right. So it's time for your rapid fire questions.
Okay.
Are you ready?
I'm prepared this time.
And
yes.
they will be rapid. Are you ready? Okay.
Yes.
Give us one moment of courage.
Resting. I'm a doer. So sometimes resting is the most productive thing you can do for the day.
Mm-hmm. You heard it from Julia. 2, what is one thing you're curious about right now?
My own body and how it's changing. And, just when you think you got something really under control, life throws something else at you. So I'm really learning to stay curious with my body, what I'm doing with it, new exercises. I'm not hitting my PBs on my Peloton right now. I'm not getting my cardio outputs high, which means I need to step back and be curious as to why. What am I doing differently? What am I not doing? What do I need to change to get where I want to go? So I added the 10 pounds and doing some heavy lifting, but staying curious about everything, but really about my own body right now. That's where my focus is.
Oh, I love it. It's so aligned. No wonder we get along. Number 3, what are you grateful for right now?
Oh my God, my backyard. So this is what you do when you can't travel anywhere. So we actually sold our cottage, renovated the kitchen, and then renovated the backyard. And we have this beautiful oasis. From the kitchen, we see the backyard now, got new furniture. I got grass. So I live in Toronto. There's no grass. And so we actually got it for the dog, which he loves it, but just this little triangle of grass. It's it's big enough for my 75-pound dog. And I just go in my bare feet and I just pause. And then I go sit under the tree. So yeah, my backyard, that's what I'm truly grateful for right now.
And nature doesn't need to be what I get to experience out here on the West Coast of, endless mountains of green, but it can be a little triangle of grass in which you sink your feet into. I love it.
Yeah. Yes.
Well, how I just thank you so much for sharing so much of what you do and your passion and your love for, female health and wellness and getting up and going. And I'm going to give you the last word.
Oh, be curious. Rest and be curious. The world is crazy, and we as women need to take care of ourselves first. It sounds selfish. It is not. Fill your cup and the rest will flow. but be curious about your body. It's such a marvel. And Mother Nature did not make any mistakes. Humans make mistakes. Mother Nature does not. So trust your instinct and your bodies and go and be happy.
Thank you so much.
Thank you, Tennille. I can't thank you enough for doing this and bringing this out into the world.
Thank you.
We need more people like you to get this information out. So I'm so grateful to you.
We're working on it.
Yes.